Good morning, everybody, and welcome to our first webinar of the California Opioid Safety Network Communicating for Impact webinar series, Framing and Messaging for Opioid Safety. We're very pleased to be welcoming everybody today. Before we get started, we want to review some housekeeping information. On your screen right now is the 866 number for WebEx. If you have any technical difficulties, please use that number to reach them. To reach us, please use the Q&A feature that's on the right-hand side of your screen with the letters Q and A. Please remember to pick all panelists from the drop-down menu and to hit send after you type your messages so that we can see it. The chat feature is disabled, so you can only use the Q&A panel. Feel free to type in messages during our presentation at any point so that we can reach it. That's for any issues related to the webinar or content-related questions. For the discussion portion of the webinar, we want to invite all of you to join us via phone. The dial-in instructions are on your screen. These are the same as previous webinars with us. If you've been on those, you will use the telephone icon, choose the I will call in option from the pop-up menu, and follow the three-step process for dialing in. We will have all of you on mute for the entire presentation until we get to the discussion portion. So if you need to reach us during that time, please use the Q&A panel. We'll be inviting all of you to join the conversation at that point in the agenda. I'd now like to bring on our director, Dr. Carmen Navarez, to welcome everybody today.
Good morning, everybody. It's really a pleasure to have you join us. What we want to focus on today is a new set of skills, a set of skills on the outside of our diagram here. Let me just go back and repeat for those who haven't been on before. In order for your coalition to be super effective and impactful, you require both skills and knowledge on opioid safety strategies, but also very strong skills that equip your members to work well as a coalition. And that's what's represented inside the oblong. Outside the oblong, we want to emphasize that there are other skills that we think are really critical in helping to unify your opioid safety strategies along with your coalition improvement. And one of them, and what we're going to focus on today, is communicating for impact. So today, as we're starting right now, I want to just call your attention to the chat box. Chat section on the right side of your screen. We are sending you a link that you can download. It contains the tools that we'll be introducing today on communicating for impact. It's also going to be available in the newsletter. So you can download it now, or you can follow it on the screen, and you certainly can get it from the newsletter. So in terms of framing and messaging, this is one of the areas where really deep skills will make you way more effective than you would be otherwise. I think that everybody knows that when you're trying to speak to somebody on a difficult topic, that if you cannot present a topic in a way that another person can connect to, you're not going to get anywhere. So we're really, really fortunate today to be having this conversation. We know that there's new research and polling data that shines a light on how we can talk about opioid safety in ways that help us surmount apathy and stigma and to strengthen support for our strategies. Today's webinar is going to offer you a conceptual understanding of framing and help you to find the best language to engage your target audiences and to move them to act. The presenters will also ask you to reflect in real time on messaging that has already been drafted. We want you to bring your ideas to us in conversation with us a little later in the call. And then just to remind you, on June 12th, we're doing another webinar on strategic communications, tactics, tools, and timing. So it is my pleasure to introduce our speaker for today. Lori Cappy has had 35 years of professional experience in public policy advocacy, research and analysis, as well as communications and social marketing consulting. And she's known to many of you as she's been providing communication support for California's Opioid Safety Coalition as a grantee of the California Healthcare Foundation since 2015. And IE Communications, her organization, continues to support the network as a partner organization with our center. So, Lori, the mic is yours.
Okay, thank you, Carmen. So I just want to quickly review the agenda for today, as you can see up on your screen shortly.
You're not going to advance slides.
No, I guess I could. Okay, sorry for that short technical glitch. I wanted to work with you now to look at this agenda so that you can see what we plan to cover here. So the agenda is first to review what we mean by communications for impact. We're then going to do a short definition of what we consider to be how we see framing. I'm going to share with you some of the recent polling in media on opioid safety, walk you through a terrific research resource, which is an organization called Frameworks, which has recently done quite a lot of deep work on this topic. We're then going to have an opportunity to do an activity worksheet on framing your work, also known as an elevator speech. We're going to reflect in real time on that activity, and then have a short period of time we're going to share with you some sample messaging and get your feedback on that as well. Okay. So the learning objectives for today's webinar are that you leave today with an understanding of the communications concept of framing and how you can apply this to developing messages. Hopefully you're going to learn to develop an effective elevator speech. Some of you may need to work on this after. Some of you may be very adept and have gone on lots of elevators where you've had the opportunity to use your pitch. And then we're going to have a brief time to reflect upon the types of messages and messengers that will be persuasive in you as you advance your opioid safety strategies. So when I talk about communications for impact, as Carmen mentioned, I've been doing this work for about 35 years, and one of the things that I always tell my clients is when you think about communications, ask yourself these two questions: for what and so what? It's not about getting a story in your local newspaper or being interviewed on the radio or sending out a brochure. None of that is important unless you have thought carefully and consciously about what is the message you need to get out there, and as a result of getting that message, what will happen or change as a result. So those are the two questions: for what and so what. And once you're kind of clear on your objectives, your for what and so what, then it's a matter of who needs to hear that message, who is your target audience, who has the ability in the so what to move forward your agenda. And once you've got that figured out, then you have to think through what is the best message to get across that point, that for what, so what. And then as a result, what might be changes in actions, what might be, for example, if we're thinking about opioid safety, you know, maybe the action you want people to take is to do a drug give back or to do safe storage. Maybe the for what, so what of another change might be a behavior change. So maybe you want to get somebody to stop buying sugary sodas or not to smoke. These are, for those of you who are public health professionals in the room, this framework should probably be pretty familiar. And, you know, another so what might be to change a policy. So, for example, maybe you want to get safe injection sites in your community. So this is sort of what I talk about when this is kind of my little graphic what I mean by communications for impact. So in the case of the opioid safety coalitions, we all know that the for what, so what is to reduce both the supply and demand with the ultimate goal of preventing opioid overdoses. And we have 3 key strategies to get to that goal, and that is safer prescribing, access to treatment, and naloxone distribution. Okay, so what do we mean by framing? So this is just a straightforward definition, and then I'm going to give you a few examples as well. So framing is an important technique of focusing the attention of people within a broader context. So how something is presented, in other words, the frame, influences people's attitudes and opinions. Framing is a form of agenda setting, the process by which a communication source defines and constructs a public issue. So let's think about that a little bit. So all people come to new information they see or hear with ideas already in their heads about the way the world works. Those existing notions form kind of the mental structure or conceptual frames that allow us to integrate new information into our brains into a coherent way. So without even knowing it, we use frames to categorize information, identify patterns, and derive meaning. So frames do matter because they can foster certain understandings and hinder others. Often all it takes is a single word or image to activate an entire frame that then determines the deeper meaning of that word or image. Once activated, frames trigger emotions, associations, values, judgments, and causal explanations. In other words, they create the tracks for a train of thought. And once on that track, it's hard to get off. So when we talk about opioids, we do so in a cultural context that's actually rife with misconceptions about addiction, for example, shame, stigma for people with substance use disorders, and a sense that a crisis is devastating and anyone can fall prey to an opioid addiction. Webinars are a little hard because I can't see your faces, so I can't tell if this is resonating with you or not. So I'm going to now get into a few examples of thinking about framing. So when we're thinking about framing, it's good practice to, before we come up with our frame, to kind of get a sense of what is the mindset of our target audiences. So if your target audience is the community at large, what might be their current context through which they're viewing the opioid safety. So to do that, two things that we use as communications professionals to get a sense of the context is public opinion polling, as well as media coverage. So I'm sharing up on the screen 4 bullet points about recent public opinion polling, and then I'm going to comment on them. There's a lot more polls out there. There's not that many specific California polls, so most of this is based on national polling. So the first bullet point here is that currently in 2018, and this is from the National Opinion Research Center, which is based in Chicago, so a very credible resource for public opinion polling. So 43% of Americans say the use of prescription pain drugs is a serious problem in their community. So the interesting thing, because NORC has been doing polling for, I don't know, 50 years, they have a lot of trend data. And so this public opinion poll shows a 10% increase just since 2016. So that shows you that the public has become much more aware of the issues of opioids in their community. That's a pretty dramatic increase, I can tell you as somebody who follows polls. We have a specific to California poll, which I think is interesting, that 3/4 of Californians believe it's very important for health plans to cover treatment for alcohol or drug use problems. I don't have trend data on that, so it's just my assumption that that is a significant increase because treatment for alcohol or drug use is an expensive proposition. And the fact that people think that plans should cover it is significant to me. 65% of Americans think people caught possessing non-prescribed opioids should receive treatment without jail time. Again, that shows a very significant public attitude that people are open to, even for those who may often be put into sort of the criminalized frame, that they believe that they should actually get treatment. So that notion that, you know, addiction is a disease, not a matter of individual willpower, individual choice. which is reflected in the the National Opinion Research Center, that 53% of Americans view addiction as a medical problem. So that's a very hopeful frame that we're entering into this discussion about how to increase policies and strategies for opioid safety. So the next slide is just a small sampling of the overwhelming media coverage that I have been tracking for the last 3 years. 3 years ago, to tell you the truth, I didn't even know how to pronounce or spell opioids, and now it seems like every day I open up the newspaper or listen on the radio or watch TV news, and there's, you know, I'm inundated with stories about opioids. Just looking at a quick analytic here, we've got 1.3 million national news results on opioids in 2017 and 141,000 results on opioids. Unless the statisticians in the webinar want to push back on that, yes, many of those are probably multiple. But the point is we have a lot of coverage. Now, most of that coverage, when you do what's called frame analysis on them, will have the word there in their epidemic. So the dominant way you're seeing all of these 1.3 national news results is through the frame of this is an epidemic, this is overwhelming, as well as quite a few stories on the collateral damage to communities. For example, the increased entries into foster care. Their foster care entries were level at about 400,000 before this recent opioid increase, and now they've increased to almost 550,000. So we have close to 100,000 more families being broken up as a result of opioids. The other frame that we see quite a bit in the media coverage is about the rural communities being way harder hit. So that the disproportionate use of opioids in rural communities, the impact that's having, and frankly, the dearth of solutions. Those tend to be communities that have way less access to treatment, where the default may be more criminalization, and despite the public's belief that people should get treatment or should get treatment rather than jail time, or that everybody should have access to treatment, we do know that the rural communities, those solutions are much less accessible or available. And I'm sure that resonates with many of you who are representing some of the Northern California coalitions. The notion that addiction is a disease also increased quite a bit in 2017. One point about that I found very interesting is that the Associated Press style book, which for those of you who have any kind of journalism background or even not might have heard about. So that's, you know, used by journalists to both look at how should they spell certain words or how should they define certain words. But the most recent edition of AP style book specifically directed this addiction as a disease way of referring to addiction. The other thing that I've noticed in the media frame analysis is that there's way more news features appearing with personal stories. There was even a documentary film that I believe won an Academy Award, or at least an Emmy, that profiled, which has the consequence of creating empathy, because if you start seeing stories where it's not a number but it's a personal story of a young man who struggled with his addiction, and then they profile the parents, et cetera, then you start having a understanding of addiction as reinforces that notion of addiction as a disease. The other thing that we've seen in the media coverage, both good and bad, is a pretty strong policy response for more resources. This started, I think, around the primaries 2 years ago, when the Republican candidates were specifically addressing states like New Hampshire and other states that were disproportionately impacted by opioids. And we started seeing presidential platforms that were addressing opioids. And of course, most recently, the White House and President Trump has called for both more resources to address the epidemic, as has the HHS Secretary, as well as some less helpful policy responses, like I believe it's death penalty for those who distribute drugs illegally. So we're not endorsing that one, but I just wanted to reflect on sort of the range of policy responses that have been put out there. So now I'm going to take a moment for you guys to absorb some of that and switch to what do we do about it? So now I've given you what I understand about framing, and we've also given you some of the context we're currently in, and I want to give you the opportunity and to learn about a tremendous resource, which is an organization called Frameworks Institute. They've been around since 1999. Unfortunately, a lot of their material is proprietary. Some of it is shared. What we're going to share with you today is part of the shared resources on some of the framing that they've done. So what they do is take some of the tools that I've just talked to you about, like they do media analysis and polling opinion, public opinion polling reviews, et cetera. But then because they have a great deal of resources, they're able to do a whole lot of multi-method, multidisciplinary communications research. So I'm basically borrowing theirs because as generous as CHCF is, we didn't have the money to do the kind of in-depth analysis that Frameworks is able to do. So let's see. So Frameworks was able to do focus groups, interviews, retesting, with on-the-street interviews, controlled experiments, persuasion trials. So they really do the whole 9 yards. And so, and luckily for us, they actually did a recent study that specifically looked at opioids and other substance use disorders and how to discuss this and how to frame it. So we're generously borrowing this work so that we can help to frame our Opioid Safety Coalition work more scientifically. So when we think about how we currently, or how the media and the polling is looking at the opioid epidemic, what you clearly see in the media framing is that this crisis is devastating entire communities, and there's a failure of leadership. So that's one frame that I think, I agree with Frameworks, has been kind of dominating the context through which we look at opioids, and that ordinary people from all walks of life are falling prey to this epidemic, and it could happen to anyone, and we need life-saving medications on hand to prevent this, such as just like we have defibrillators and EpiPens. So this study they did in Alberta, Canada, but I really feel like everything that they're saying in terms of the current framing, it resonates at least with me and the couple of years that I've been working on this. So now here's the idea of how to reframe it, and I'm going to go into a little bit more depth with you guys on this call. So the reframe is that this is an issue that's going to require all the ingenuity we can muster. We need to work harder and smarter. And that's because these painkillers are prescribed widely and can quickly recalibrate the brain's reward system. And addictions can change over time, so must our responses. So now I'm going to go in a little bit more in depth in terms of how you would pivot from the current frame to the frames that, that Frameworks is suggesting. So when we think about a crisis framing, and I can't do a show of hands, but I as well have been completely guilty of this in the last couple of years, is talking about opioids as an epidemic and a crisis. And so when we use that language or that frame, what that does is that, And this is based on a lot of research, but basically the more you hear crisis, you end up with sort of a limited capacity for worry. It's like, okay, I've got this crisis, I've got the crisis in Syria, I've got this, I have a gun violence crisis. I mean, there's only so much crises you can kind of hold in your brain and in your response menu. And the reality is that as much as this definitely fits the criteria for those of you who are in the public health sphere of an epidemic, and I don't find that use of the term problematic, but the more you frame it that way and you're out in the community trying to get involvement, the more somebody might say to you, but should I work on this one, or gun violence, or, what should I be working on? And the reality is that for every one overdose, there are 100 opioid dependent users, people who are dependent on opioids, and we have about 800 or so that are using opioids for a non-medical use. So I don't know if, I think we need to kind of recalibrate our use of the word epidemic. And so how should we reframe it? Well, here's the reframing that I would say I think is very smart. The reframe is reframing this crisis to something, to ingenuity. So the notion that we can do it. I mean, I think for those of you who are out in the community organizing or doing your elevator speeches, if you start with the idea that we can restore and repair our community through a thoughtful and coordinated approach, we can, which is what we're doing. I mean, the reality is that we're taking this thoughtful, coordinated approach of safer prescribing, which gets to sort of early intervention and reducing supply. We're addressing this by saying, let's get the naloxone out in the community so we can prevent the overdoses, and that we need to promote access to treatment, which is evidence-based medical and behavioral response to addiction, and getting it into all settings, from the emergency room to the jails, and truly accessible to our rural communities. Secondly, the other reframe that I think is a really valuable reframe is the reframe from empathy to interdependence. So part of the takeaway I have from the personal stories frame that's been in the media is that what that's doing is, which is a good thing in a lot of ways, is it's creating empathy with people who are addicted. But the problem with empathy is that it can sometimes reinforce fatalism about addiction. In other words, if you have empathy for that addict, person with addiction, I don't want to say that addict, I want to say that person with addiction who has that disease, then sometimes it can lead to a sense of, well, this is controllable but maybe not curable, or the damage done is the damage done, or some things are just too addictive, or even something about blaming the victim. They have a very high ACEs score, adverse childhood experiences, or they, were in prison, so it makes sense. And what we want to reframe that into is the notion of interdependence, that yes, we want to have empathy for people who have the disease of addiction, but we want to do something about it. We want to think about it as something that we can take collective responsibility, and that it is a problem that actually can be solved. So that's an example of reframing from empathy to interdependence. So is this working or not? Here's it hasn't been, this Alberta research hasn't been out that much. You guys are getting sort of a early insight. There was a recent article in Governing Magazine which reported on it and said that with their testing of it, the message so far, that this is actually moving more people to, greater involvement in some of the strategies that we're forwarding. So now I'm going to take a pause, and I'm going to turn this over to Karya, because we really do want to have an ability for you to leave today with not just a conceptual understanding, but a practical understanding of framing.
Great, thank you, Lori. Lots of excellent information here. So we're going to take a break and spend about 25 minutes doing a discussion now, and then go back to some more examples and information from Lori in presentation form. But for this portion, we wanted to be able to provide a tool as well as some live TA with Lori around framing. So in your chat feature, you have a link to this tool. It's the full tool that you can use afterwards. But what we're going to do right now is just a little bit of practicing with it to introduce it to you, similarly to what we've done on our past coalition building webinars, and then you'll be able to work with it following the webinar, hopefully with a little more foundational knowledge. So on your screen right now is the portion that we're going to be going over live on the webinar. So you're going to say whatever your coalition is with a brief basic descriptor, what the function is of the group, the audience of your message. This is very important just so we know partly how to respond, as well as a tool for you as you're developing it, but it'll help in our live TA here. We are committed to, and you're going to provide some information about your purpose or vision. Our coalition is unique because, and then something that might be a differentiator about the work you do as a coalition. And then a personal note, I believe in, you insert your coalition name because, and you would list 3 reasons or 3 positive outcomes that your coalition has achieved. So we're hoping that people can walk through this, or which parts that they feel like they have something to articulate about. I'm going to have Lori go over one kind of summary piece of how she's going to reflect back with you about the messages you share, and then we'll start calling on people. We're going to do this similarly to like we've done before, so people that are on the phone will be calling on some of you and unmuting you at that point. This isn't about having the right answers. This is about building the learning community and being able to learn from each other about the information that you're getting and how to share. So we hope people can engage in the learning environment and feedback in that spirit. So for each of you, as we call on you, we're going to have you walk through the parts that you're able to cover of the worksheet, and then Lori can provide some sort of live response with you. But first, I'm going to have Lori go over the reflection points, and then we'll go back to the exercise.
So to make an effective elevator pitch, and this can be the Sears Tower or even a short 5-story building. So brevity is worthwhile when you're repurposing your elevator pitch into a tweet. It can work better if you're trying to come up with, you've got a long period of time to really explain your coalition. You've got a brochure you're using. So the word elevator pitch is basically where you get an opportunity to include your framing and values. In other words, just like we talked about framing now for the last 15 minutes, what the values of your coalition are should get reflected in your elevator pitch. It should be clear about who, what, how, where, and why this matters. So that should come through as well. And I prefer it if an elevator pitch also includes some sort of call to action, like the for what, so what of your exchange with the particular target audience. So let's see, now you're working on your worksheet.
Go back.
No, we're going to go back.
Sorry.
So I want you to see the worksheet in front of you. And as I think Carmen said at the beginning, you have a copy of this that you can download if it's a little difficult to read on the screen. You'll also get this in a newsletter. And this is going to be sort of ongoing homework for some of you in the next couple of weeks. And I do acknowledge that some of you in the room may have A+ elevator pitches already developed, but for some of you, you may not. So there's going to be, I'm sure, some variations in how adept you are at filling in these blanks. And so if you see up on the screen, you see some of the blanks. So now I'm going to turn this over to Karya, who's going to put some of you on the spot, or maybe she's already clued you in that she's calling on you.
So we have, thank you, Lori. So we're going to start with Chris Herring from the Imperial County Coalition team. We've unmuted you, Chris.
Hi, how are you?
Hi, good. So you're our first person here. So we're going to walk through the kind of questions that are on the screen, or have you walk through them. If you have a portion of it that you want to focus on, you can do that as well, like around the purpose or vision, or maybe the question at the bottom around what you believe in around your coalition. But you can kind of walk through for us which coalition, the audience, and then the other questions on the screen, and then Lori can work with you from wherever you're starting from.
So we're starting from scratch here. Sorry,
Excellent.
I'm getting over being sick for the last week. So basically, we are the Imperial County Overdose Prevention Education Coalition. Right now, we're focused mainly on our healthcare providers and really trying to work in on the safer prescribing because we are starting pretty new, and that's kind of where our coalition has come together around from those groups. So it's kind of our easiest place to start. Does that make sense so far?
Yeah, perfect. Thank you.
That's perfect. So we've stepped into the elevator. We're up to floor 5. Mm-hmm. So now you have me in the elevator, and I'm actually, think of me as a major healthcare provider in your county. So what do you want to talk to me about from floor 5 to floor 15?
So really, you know, one of the things we're trying to do now is identifying better data sources locally than what's currently available to us. So right now we're trying to work with the providers to get the data that we need as a coalition to really delve into what our opioid problem is in Imperial County. So that's where we're at.
And is it my understanding that your background includes being an EMS?
Yes.
Okay, so tell me what are 3 reasons that you've joined this coalition? Why do you think you're going to make a difference from that perspective? Remember, you've got this captive audience in the elevator, so, you know, tell me why this matters.
So my experience with EMS and what we see within Imperial County right now is pretty anecdotal as far as what our opioid problem is. Right now, we still see more of the street overdoses, the street drugs, the heroin overdoses than anything with prescriptions, but that's just because of the data sources that we have. We know we have pretty high rates of opioid prescriptions, particularly in some of our outlying communities in the north end of our county. So what we're trying to do is really identify what the problem is so we can work as a group to come up with solutions for improving and, you know, one, decreasing the opioid prescription rates where we can, and decreasing our overdose rates.
So when I critique an elevator speech, one of the things that that I like to do is have a combination of data and stories. So one thing I would advise you going forward is describing who's in your coalition, including you, and using that as a way to frame the work. So right now what you've given me is we're not really sure if we have a problem. And so what I'd like you to think about in terms of reframing or your elevator pitch is to say, as somebody in the community and after talking to many people in the community, we have anecdotal data or information that that overprescribing or we need safer prescribing in the community, and this is why. So right now what you've done is raise questions for me, but you haven't given me a sense of what is the purpose and vision of your coalition. So once you get this hard data, what are you going to be able to do with it, and how would safer prescribing be implemented in your county?
Okay.
So I'm giving you that prompt.
Right. So really, we'd like to be able to take the data that we get back to our healthcare providers, both in our 2 hospitals, our clinics, and then our primary care providers, to be able to show them where our opioid problem is. We'd like to be able to identify those providers and facilities that have higher rates and see if we can work on the solution to decreasing those prescription rates.
Okay, perfect. So that is an excellent way of kind of taking that person trapped in your elevator up to floor 15. And if you want to continue working on filling in the blanks of this worksheet and sending it to me for further critique, or maybe you don't want that, but in case you do, I'm open to giving you some more feedback. So now I'm going to turn it back to Karia, who's going to bring in another person to.
Great. Thank you, Lori, and thank you so much. So we're going to now go to Holly Duffy from the Humboldt Coalition. We have you unmuted, Holly. Holly, are you there? No, Holly. You might be on mute. We can't hear you.
Sorry, I was on mute on my side.
There you are. Hi, welcome. So we're going to do the same process that Chris just so wonderfully exampled for us. So on your screen right now are the prompts and kind of questions, and then Lori is here to work with you.
Yeah, so we have a couple coalitions, so I'm going to be talking about only one of them and not the other one. So ESAP is a coalition which is made up of several different community members. It contains people who are in environmental health, people who are in law enforcement, and community members. And they're working together to try to reduce stigma around opioid use and institutionalizing medication disposal in Humboldt County. So in the past, they have placed 6 medication disposal bins around the community, but obviously it's hard to scrape together funding for this, so they're looking at passing an in-producer responsibility policy. So right now they're looking at how to educate and advocate for that with policymakers. But that's all I've been able to come up with so far.
Okay. Okay, so we're in the elevator. And so let's think about who is your target audience for the elevator speech that you just gave. So it sounded like your call to action at the end was that the need that you have is did I hear you right? Were you saying funding? Is that the need, one of the needs of
institutionalize funding? So like not having to scrape together different sources for medication disposal, but to have it institutionalized in a policy.
And the ask is for medication disposal? Is that the word you were using?
For medication disposal, yes.
Disposal. Okay. So so the target audience for that ask is policymakers. So there's some policymakers in the community who you believe could help institutionalizing funding for medication disposal.
Yes.
Am I hearing you right? Okay.
Yes.
So so why would medication disposal matter? I guess that's the linkage that I'm not quite sure of. So what is the purpose or vision?
Disposal. Okay. So most people, well, many people who become addicted to prescription opioids report getting it from friends or family members' medicine cabinet. So when people dispose of medication properly, they are not only preventing damage to the environment and keeping it out of waterways, but they're also keeping the community safe and removing that point of access for people to become addicted to opioids.
Okay, that was excellent. So the for what, so what of medication disposal should be a key part of your elevator speech. And so how I might reframe a little bit of this is because that was what was curious to me when you first talked about who was in your coalition, because you led with environmental, I think environmental people or environmental advocates. Yeah, so environmental health. So that's an interesting thing. So, so that might intrigue me to pay attention to you from 4.5 to 4.8, because that's kind of new information. That, and if you had a data point on that, would really make your elevator speech much more effective. So you said many people report that the way they've accessed opioids is not necessarily how, you know, the specter of the media, which is, you know, the cost of opioids go up and then they turn to the streets and go for heroin. That's the frame that, if you read a lot of the media, is the dominant frame. And in fact, you've added just some very salient new information to the dialogue, which is, no, it's in, you know, the medicine cabinet when you went over to your friend's house. And so that's why we need to do public education to tell people, once you've been given this opioid prescription and you've finished your course of the prescription, dispose of it safely. I mean, that's a, you know, a very important public education campaign that could be posted in drugstores, and in even the PTA could amplify that message by letting people know that, you know, if your friends, if your kids' friends are coming over, have you gotten rid of your opioids in your medicine cabinet? So anyway, I'm just giving you a little critique on making it clearer your for what, so what of a key strategy of your coalition. Can you tell me quickly, what do you see happening as a result? What are, you know, 3 positive outcomes that the Humboldt Coalition hopes to achieve by this campaign?
By institutionalizing medication disposal. And
how would I measure that?
So we can measure it through how much medication has been disposed in each location.
Okay, so, that's an excellent metric.
Yeah, so we could do that. We could measure it by, like, how, I guess, youth accessing medication in the home. That could be another metric. The third metric. I'm not sure what the last one would be.
Well, I think all, well, and I guess the for what, so what overall, and as a result, we hope to see fewer opioid overdoses.
Oh, yeah, absolutely. Or even less.
So always bring it back to the main value or core goal of the coalition. Yeah. Okay, so let's see. Thank you very much, and please feel free to continue to work on this worksheet, and I'd be happy to give you further critique or clarification on how to make your messages more impactful. And now I'm going to turn it over to Karya, who's going to call on another coalition.
Great, thanks so much, Holly. I'm now going to bring on 2 people that are from the same coalition, Jamie Rich and Patty Hoyt. You're both from Contra Costa Meds Coalition, and we're meeting both of you at the same time, I think. Or we think you're both on.
Here.
Jamie Rich.
Jamie, are you on?
You both there?
This is Patty. I'm on. Can you hear me?
Hi, Patty. Yes, we can. And Jamie, are you there?
Yes.
Hi. Great. Okay. So we'll have both of you on, and you can, either of you that can, you know, take the ball first and start working on the pitch, and then the other one can pick up from there, and then Lori's here to provide some feedback.
Jamie, I'll let you start.
Okay, thanks.
You can handing the ball off.
Okay, so the Contra Costa Meds Coalition is a community-based coalition that serves to raise awareness, educate the community at large. We are committed to reducing opioid prescribing, increasing naloxone distribution, and spreading education as to the opioid misuse and abuse. We are unique because we are made up of mostly prevention folks and community-based people who are really on the ground working this cause and are very committed to the cause. And, you know, we have a few calls to action, so I don't know, that was going to kind of be my question as to whether to make it broader, you know, if you're doing an elevator speech and talk about all your different calls of action, or whether to concentrate on one. Like, we want to see, we do want to have more sites, I guess you'd say, or opportunities to educate the community, which would mean people letting us in, you know, giving us a place to educate, particularly schools, communities. We want to see an increase in naloxone distribution, which means working with, you know, specific entities to increase their distribution of naloxone. And the for what would be the ultimate to reduce opioid overdoses and deaths in the end, in the community.
Okay, so that's really good. You definitely got me up to 4, 5, 6, or 7. I think to your question about should you have multiple calls to action, I think what you've described is very integrated. I mean, I think the way you might segue from the excellent introduction about the name of the coalition and that we want to educate the entire community, we believe it's important to raise awareness and educate the community at large about the extent of opioid use in our county. But then you say, well, and this is a multifaceted problem that requires multifaceted solutions. So that's how you would very easily segue to one of the problems we believe is that the public is not necessarily aware of the dangers of opioid use. And so one of our strategies is to educate the community, and to do that, we need to be in schools, in libraries, in senior centers, in you know, multiple venues where we can get out that word about the dangers of opioid use. And then, because this is a multifaceted problem, we understand that many people are already suffering from opioid abuse, substance use disorders, and so we need to give those folks second, third, or maybe fourth chances by providing them with a life-saving opioid overdose reversal medicine, which is called naloxone. And to be able to accomplish that, we similarly need to educate the first responders and family members and others so that we can have naloxone throughout the community. So I'm just modeling that for you to show you how you can, in fact, not worry about, you know, who's in the elevator. You can give multiple audiences the same pitch. So I think we had 2 people from Contra Costa. So I want to give the other person a chance to give their elevator speech as well. And don't be alarmed. I'll be kind.
Well, this is Patty, and that's why I let Jamie go first, because she did such a there was a reason. There was a method there. And I cover some of it. I guess I have some questions, because there's a section here where you talk about 3 positive outcomes you've already had. And I just wondered, is that something we incorporate or something that makes us unique? I think one of the things that's unique about our coalition is that our chairperson has a personal tragedy that caused her to be into this field because her son passed away. And so I think that, once again, it's deciding how to use the personal story like you were talking about previously. Is that something we don't use because of all the other stuff?
Well, I think that's an example, and I'll answer the question. I think the chairperson with that personal story adds a lot of credibility to your strategy, because it's obviously the reason this person became chair of it and is leading this cause is because this tragedy affected their community. And I'm sure she's in, I don't know if she's on the phone and I don't want to speak for her, but, I'm sure she would say, if only I had known.
Oh, absolutely.
So, yeah, so if only I had known is the frame that is the reason your coalition has exists. Well, then your strategy of making sure everyone knows makes a lot of sense. So, you can easily incorporate that into your elevator speech because you can say exactly that. We're focusing on community awareness and community education because as our chairperson, fill in the blank name, if she, she lost her son as a result of not knowing. So we feel that, and this is that's something unique about your coalition, that this is purpose over pain. So she's finding purpose over her personal pain. And you're moving forward because you want to prevent that kind of tragedy affecting the larger community. Absolutely. We don't want more people to have to go through that kind of pain. And we believe that the more people know, the less frequently we will have this kind of tragedy in our community.
Okay. And so in this elevator speech, to incorporate what Jamie already said and add that too, where does that fit? Does that fit into our, sort of call to action, why we're doing what we're doing?
Yeah, it's the rationale behind your strategy. So I would fit it in potentially there as well. And again, just like I've offered everybody else, fill out that worksheet more completely, and I'll be happy to provide you lots of, further critique and fine-tuning of your speech. And again, it also is going to depend on who's in the elevator with you. So you want to think about your elevator speech as targeted to your particular audience. So, if you happen to have somebody, the head of the Contra Costa School District in the elevator with you, then you could give them the pitch of, and can we come and offer this curriculum to all of your high school students or something like that.
Right. Okay. Great info.
All right, I think Taria has one more coalition she's going to call on.
Yeah, so we'd like to bring on Rebecca Munger from the Redwood Community Health Coalition. We have you unmuted.
Yeah, hi, this is Rebecca. Can you hear me?
I can, hi.
Great, okay, so hi Lori. So let me try, this is my first attempt, so I'm going to say the Redwood Community Health Coalition is a coalition of community health centers in Marin, Napa, Sonoma, and Yolo County addressing opioid abuse disorder in our communities, and that we support quality improvement through collaboration and sharing of best practices among physicians, pharmacists, nurses, dentists, behavioral health, and treatment providers. And we are committed to providing quality care to vulnerable populations to improve health outcomes and reduce improve health outcomes and reduce the burden of addiction. And our coalition is unique because we focus on the role of primary care in addressing the opioid safety. And then I'm involved in RCHC because we have been successful in adopting safe opioid prescribing guidelines across our members, and we've also been expanding access to medication-assisted treatment in primary care settings and increase the number of patients that we can serve, and that we feel we can do more in terms of reducing overdose deaths by co-prescribing naloxone. I'll stop there.
Wow. You got us up to like floor 12, and I'm really clear about who you are, what you're doing, and your values. The one thing, and it's hard to critique that because you did an excellent job. The one thing that I might ask you is, how many years have you been in existence to get to this level of achievement? And do you have any concrete results that you can share, that you can name or number? So you did say that you've been able to get safe access across, provided across your members, and you've been expanding access to medication-assisted treatment, particularly in primary care. So I guess my only critique of this would be, that would add value to it, is to get me some specifics, like you gave me some positive outcomes, but they were very kind of generalized. So what might make this more effective is, and I'm just filling in a blank here because I don't know what it is, but in the 5 years of our coalition activity, we have enlisted the support of 300 primary care providers who, prior to our coalition work, less than 10% extended or had access to MAT in their settings, and we're shooting for 30%, and we currently have 15%, or something that could inspire me to understand the progress you've made.
Yeah, that's helpful, and I do have access to those kinds of numbers, and I could just add a little piece, that since 2015, XYZ, so that's great.
Yeah, so that would make me then say, going back, if we remember the framing, that shows the ingenuity that you have adopted to confront the opioid overdoses in your community, that you've taken these very strategic approaches and used your ingenuity to make a difference. So now I'm going to turn to, hold on, the worksheet activity discussion and reflection. So as you see, part of my critique of these individual coalition elevator speeches was to have a reflection on whether the concepts that we covered in the beginning of this webinar of interdependence and ingenuity, whether or not some of you use that. So as you can see, I kind of tried to interject the idea that opioid overdoses are a community-wide problem in one of my critiques, I can't remember who, that will require a community-wide response. I think that was in the reflection that I had on the Contra Costa example, and that and then the second one, which is showing the ingenuity, is that we're actually forwarding strategies that work. So that was what I was trying to kind of reframe or critique in the last one, which is that I think it's important that you put in the frame that what we're doing is working. That safer prescribing, naloxone access, and addiction treatment are all strategies that can deal with this current situation or problem in our community. So when you go back and start working more with the worksheet that we provided, I just wanted you to see an example of what it could look like. So it could look like X coalition is a, and many of you had a good quick descriptor, but a basic descriptor is sort of the who is part of your coalition. So that's why I lifted up the coalition that talked about the environmental health folks being. So the who is in your coalition also is a good description of and a way to pull in others as well. So you may be a coalition that's dominated by public health folks or by law enforcement, but put that in, like the who is in your coalition, into your basic description. And what are you doing and why, and who should know about it? So all of that should be in kind of your first line, and what you're committed to, and why this is special, and why, and I always do encourage people to include why you're involved or committed or passionate. So just like the Contra Costa Coalition described, the fact that many of the people in our coalition, like myself, that happen to be your chairperson, are passionate about our work because And that's where you might put that personal story, or like our first coalition, the fact that he was formerly in EMS, or that's his background. And then what do you hope to accomplish, and how that person can get involved that's in the elevator with you. Okay, so now I'm going to take a breath and give you 3 quick examples of how to message our strategies. And I clearly don't have all the strategies, but some of you talked about the fact that you're also working on general awareness or safe disposal. So I'm focusing on these 3 strategies, but again, with the technical assistance that you'll be offered by IE Communications, we can help with messaging the sub-strategies or alternate strategies that you're working on to reduce opioid overdoses. So as I go through these 3 examples, you're going to see on the side of your screen some poll questions. And this is, we're not opening up the phone lines again. This is going to be where you can online answer those poll questions. So the first strategy I wanted to talk about is safer prescribing. So remember our very first slide where we talked about the for what, so what, and then who are your target audiences. So once you're clear, like we are now, that our overall goal is to reduce opioid overdose deaths, and that one of our messages is the need for safer prescribing. That's one of our key strategies. So who needs to hear that message about safer prescribing? Well, in this case, the target audiences are physicians, dentists, health plans and providers, patients. The patients are a target audience because we need to manage demand by creating a more informed public. And I think the Contra Costa folks kind of spoke to that as well. So now, what would be the overall framing for the safer prescribing? The framing for this is each patient has a different response to a prescription, and we must evolve our responses and focus on getting patients out of harm's way. So that's why we need safer prescribing. We do know that many people are prescribed opioids can be prescribed opioids in perfectly safe ways. This is, you know, a correct physician response to some form of acute pain or post-surgery, et cetera. So the idea of safer prescribing is that opioids are not effective for chronic pain. And that's been a message that for those of you who are curious about the data or the science behind that, I refer you to particularly the California Healthcare Foundation website, which has a number of excellent papers that address that. The other message is that there are alternatives for pain management. So I have been pretty much schooled in the last 2 years, partly because my son is studying to be a chiropractor, that there's a lot of things that you can do for back pain. And finally, that by being resourceful and innovative, we can make a difference. So in other words, you don't necessarily need the 30 doses, or what do you call it, 30 pills for oxycodone after you get a wisdom tooth removed. You know, that there's other things that you can do that can make a difference. So now I'm going to give you just some examples that I pulled up from some of the coalitions. So you see in front of you, and me, Mendocino County, which produced a flyer that they put at, that they did in partnership with some of the local health plans that gives a lot of data about alternatives for, well, first of all, it describes the problem, but then it gives a lot of data for ways that you can manage pain. And then we have one from Placer, Nevada County, where they used a big visual image and again gave what are some of the alternatives, that there is no magic pill. I thought that one was pretty good. So now what I'd like you to do is take a moment, or maybe you're doing it while we're speaking, and tell us which of these messages you felt resonated with you, so that opioids are not effective for chronic pain, that there are alternatives, and, you know, we can be resourceful and innovative to deal as alternatives or as reasons for safer prescribing, or it may be all of the above. And if you'd like to write in to the Q&A function, you can let me know. I mean, I only have Mendocino and Placer, Nevada here, but maybe your coalition has come up with a particularly good message that you're using to encourage safer prescribing. And if you write that into the Q&A function, we're not going to open up the phone lines, but we can then share them, and so that we can encourage some peer sharing and peer learning here. Okay. Okay, so now I'm going to go to, Karia, did I give enough time for that? Mm-hmm. Okay, good. So now we're going to go to our second key strategy, which is access to treatment. So the target audiences for access to treatment, as listed here on the slide, are physicians and primary care providers, and particularly a for what, so what there is potentially to encourage more of them to get an ex-licensing waiver so that they can do medication-assisted treatment. We also need to involve our behavioral health partners and pharmacists, because MAT requires those partners to be effective. We want to talk to ERs and clinics, because we want to encourage induction at those sites. And of course, we want to encourage patients who have substance use disorders and their families to access medication-assisted treatment in pretty much all settings. So those are the target audiences. The framing for this is that successful treatment is difficult, so we don't want to underestimate how difficult it is to overcome these addictions, and the fact that these addictions many, many times, even with MAT, include relapse, but that a sustained multimodal approach is needed, and the earlier the better, but later can work too. So we want to be encouraging in the framing. And again, this is thinking about our ingenuity frame that we talked about conceptually at the beginning. So some of the messages are that it's a proven strategy, that it works, but there are gaps in treatment and more providers are needed, and that while treatment, you know, sort of a key message here, in particularly in many of the rural counties, is that treatment is not available to almost 90% of the people it could help. And where I put that little insert in our county, that means, and insert numbers and statistics, I want to encourage you to all look at the CHDF website. There's a really terrific tool there that I think we talked about in, it's on the website of, for the Opioid Safety Network, and it was also in a recent newsletter. It's a really terrific tool that gives you county by county data on the gap between those seeking treatment and how much treatment is actually available, which is definitely can be a motivating factor in your work in the community. So now you get to reflect on what might be the, of these messages, what might be the, which you think resonate most. And again, you can use the Q&A function to tell us how you've messaged MAT. But I also want to show you a few examples. So the one you have on the slide now sort of gives you a visual of the benefits of medication-assisted treatment for recovery. And so it has sort of the three key messages, that it reduces drug-related overdose deaths, it reductions in disease and violent crime, and improved treatment outcomes. Another example is basically the slide that gives some of the data that is available on the, I forgot what they're called, scorecards or report cards that are on the CHCF site. But that, you know, you look at that visual between where are the highest overdose death rates and where is there the least access to treatment. And I know we have some Humboldt folks on the phone, and so you can see your county clearly in the least access to treatment and the highest overdose deaths. So now, on terms of poll results and reflection, if you haven't already filled it out, which of the messages do you feel resonated the most? And, you know, have you experienced any pushback on efforts to expand treatment in your community? And again, you can use the Q&A function for that reflection, and make sure to send it to the option of all panelists. Oh, and I've just been pointed out that I do see some of the results on this one up on my screen, and it looks like there's sort of the one that people felt was most resonated was that MAT works, but there are gaps in treatment and more providers are needed. So that seemed to be the one that resonated the most. Okay, so now I'm going to go to the third strategy, which is naloxone distribution. So the target audiences for naloxone distribution are, again, the patients, in this case as well, pharmacists, people with substance use disorders, first responders, EMTs, and community settings. There was a story last year, which I believe was in Humboldt County, about a librarian reversing an overdose because she had naloxone access in the library. So, you know, there's plenty of places that one might not think of. And so I want to inspire some of you, particularly, for example, the Contra Costa folks who were concentrating on or have as one of their strategies naloxone distribution, to don't forget your libraries. So naloxone distribution, the framing for this is that this complex issue is going to require ingenuity and understanding, and we need to work harder and smarter to make an impact. So we need to save lives, which is what naloxone can do. The other message is naloxone is something all opioid users and their families should have. So in a way, what you're doing there is you're destigmatizing it. You're saying that, you know, just right from the beginning, when you get that opioid prescription, make sure you carry naloxone, because, you know, even safe use can result in a potential for an overdose. And, you know, this third message I think is important as well, because when you use naloxone, you're not endorsing someone's addiction by giving them naloxone. You're actually protecting their life. So on the side now, you can see there are there's another question. So which of these messages do you believe resonate the most? And I see there's a little error in this, so it's just A, B, and C. D should actually be all of the above. Sorry about that. And now, while you're filling out that polling question, I want to give you a few examples. So the Northern Sierra Opioid Safety Coalition distributed this flyer when they launched a community naloxone distribution program in partnership with all of the crisis intervention and resource centers in Plumas County. So for those of you who haven't taken that tactic, learn a little bit from Northern Sierra. So they contacted all these folks. The first thing is that they had a key leading question, you know, trying to hone in on their target audiences, which is, are you taking strong pain medications? And then instead of using the word opioid, I thought this was kind of a good way to approach it. And then define it. All these medications are actually opioids. Hopefully I'm saying that right. And then encouraging people to ask their provider for naloxone. So this is a good example of messaging naloxone access. And I also want to point out in the couple of years that I've been working on this issue, again, I had no idea what naloxone was 2 years ago or 3 years ago. Now, we've really kind of pivoted it to a pretty significant level of awareness when we've got the Surgeon General, and this is this Surgeon General, guys, issuing an advisory that encouraged more people to routinely carry naloxone. This was covered on NPR, the New York Times, USA Today. So that shows that, you know, we're getting some good lift in awareness from, you know, the top doc. So as you now have hopefully filled out your poll on naloxone, let us know which of those messages resonated for you most effectively. And again, in the Q&A function, and we'll share this as part of our ongoing effort to have some peer learning, coalitions learning from other coalitions, let us know what messages your coalition has used to encourage naloxone in distribution, and maybe even what are intermediaries or settings that you've reached out to. You know, have many of you gone to the crisis centers, to the veterans centers, to the libraries and school settings? So it's the target audiences that I'm interested in as well. I just looked at some of the Q&As, and one of the comments was that the polling is going too fast. So apologies for that. I didn't see that that comment till now. The other comment I had is that we've had pushback on naloxone from some of our first responder agencies. And I know that's a tough one. It's sort of getting to the pushback I've been hearing for quite a while. It's the framing that people have that are you condoning addiction by giving somebody the life-saving medication? I don't know how else to word it. So it's sort of, the way to respond to that is through the frame of, you know, addiction is a disease. And would you deny somebody an insulin injection? You know, so there are many ways to use a metaphor to respond to that kind of comment. Not to say that it doesn't require education. If you could get an EMS or a first responder or a fireman or somebody who is on the front lines like that to be the messenger for that message, that would be all the more effective. If you could get somebody, you know, the ideal thing is, you know, a fireman who maybe lost his or her son as a result of an opioid overdose that can talk to their peers and say, hey, buddy, you know, don't deny or not take naloxone on your carry in your truck or in your, if you're law enforcement, in your kit of response tools, because you may save a life and that life could have been my son. So the way you overcome that kind of pushback is to think carefully about the message and the messenger. And provide them with the facts, and the fact that is we have this opportunity for people to get a second chance or a third chance, or whatever chance they need, but they're going to be able to walk around in this world. Okay, so I'm just looking at our time, and we have 4 minutes left. So what I want to do in our 4 minutes is just quickly review with you some of the next steps, and that should be the slide that's up here now. So take a few moments to fill out the evaluation form, and if you can, reflect upon our initial learning objectives. So did you get what we promised you would get from this webinar? So were you able to understand the communications concept of framing and how to apply this to developing messages for your own coalition? Did you learn to develop an effective elevator speech that helps you express the work of your coalition with ease and authenticity? And reflecting upon the types of messages and messengers that will be persuasive in helping you to advance your opioid safety strategies. So I really appreciate it. I love feedback and to know whether or not we met those learning objectives. I'd like to encourage you to continue to work on the worksheet and share it with your colleagues. And now when you see that biweekly opioid in the news that we post every 2 weeks on the Opioid Coalition Safety Network website, you know, you could look a little bit more critically at those articles and think about what frames are being used. You can also look for opportunities to engage local media and your coalition members, letters to the editor, pulling out articles or key facts that you can include in your elevator pitch and your community awareness efforts. I also want to tell you that you should stay tuned for some sample tools for your communications outreach. We're going to be sharing those on the website. And finally, register for our next Communications for Impact webinar, which will be in June. And that webinar will be really about how to develop strategic communications. And we will give you some tactics and tools and timing. So it'll be much less conceptual and much more practical. And I hope to have all of you and more of you on our next webinar. Thank you very much. I'm now going to turn it over to Karia.
Great, thank you so much, Lori. Lots of excellent information, and we do have this being recorded, and we'll be sharing the recording as well as the slides in the next weekly updates. You can look out for that, as well as, again, a link to the tools so that you can continue to work on your framing with the rest of your coalition members. Some upcoming webinars that we just wanted to call your attention to. We have on May 1st, Preparing for Sustainability. Then we have another webinar related to our 3 opioid safety strategies. On May 17th, Strategies to Reduce Opioid Demand. And then the third in that series on June 5th on Strategies to Prevent Overdoses. And then, as Lori mentioned, a second one with her and her team on June 12th on Strategic Communications. So we hope that you guys will join us for those. Again, these are the core webinars to introduce you to quite a bit of material from all of our partners that we find to be very foundational to the work that we're doing. And we're working on our plan for rolling out of additional technical assistance based on what we're learning from all of you as we begin this work with you. So thank you, and we hope you have a great rest of your day.